Before we begin this lesson, please note that the information provided here is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Welcome back to Family Caregiving for Older Adults. I'm Dr. Thomas Scotton, and I'm very glad you've joined us for Lesson 4, Recognizing and Respecting Diversity in Care. This is a vital topic for any caregiver looking to provide truly person-centered support. Every person you care for brings a lifetime of identity, values, beliefs, and experiences. Their cultural background and personal history all shape how they understand health, how they communicate about their body, and what they will and will not accept in care. When caregiving honors these dimensions, trust deepens and communication improves. By the end of this lesson, you will be able to describe what cultural competence means in caregiving, identify common areas where culture shapes health behavior, adapt your communication to the individual, and recognize when it's time to seek additional professional support. Cultural competence is not a checklist. It is an ongoing practice of awareness, learning, and humility. It means recognizing that your own background shapes your assumptions and that the person you care for may see the world, illness, and the body very differently than you do. Culture includes language, religion, spirituality, gender identity, socioeconomic background, and family structure. Every person holds multiple cultural identities simultaneously, and the weight of each shifts depending on the situation. Our goal is to respect every facet of who they are. Cultural humility asks us to approach each person as the expert on their own experience. It means listening more than assuming, asking more than concluding, and being willing to be corrected. We aren't trying to memorize facts. We're trying to ask the right questions of this individual in this moment. A useful frame for this is the LEARN framework. Listen with empathy, explain your perspective, acknowledge both differences and similarities, recommend options, and negotiate a plan. This approach works across every cultural context because it centers the person's own voice in their care. Culture profoundly shapes how people understand illness, what causes it, what heals it, and who has the authority to make decisions about it. These frameworks are not always biological. They can be spiritual, social, or historical, and all are valid to the person experiencing them. This matters because it affects whether a person will accept a diagnosis or discuss end-of-life planning. A person from a community with historical medical mistreatment may distrust the health system, while another may minimize pain due to cultural norms of stoicism. Your role is to understand these frameworks well enough to communicate across them. Decision-making authority also varies. In many cultures, health decisions are made by the family collectively, not by the individual alone. An older adult may defer to an adult child or a community elder. This is not a sign of incapacity. It is a cultural norm that must be respected while ensuring the person's own voice is still heard. Language is a safety issue. When English is not a person's primary language, the stress of illness may cause them to revert to their first language. Use plain language, replace hypertension with high blood pressure, and confirm understanding with the teach-back method. What will you do when you get home? Nonverbal communication also varies. Eye contact, physical touch, and the meaning of silence all differ across cultures. Observe these cues and do not assume your own norms are universal. If you are ever unsure whether a gesture is welcome, simply ask permission. Is it all right if I take your hand while we talk? Religion and spirituality are often core to a person's dignity. These beliefs may govern what happens to the body, what rituals must be performed, and how loss is expressed. Ask early, are there practices or beliefs I should know about to provide the best care for you? Documenting these answers is a vital form of respect. Personal care, bathing, dressing, and physical examination is intimate. Cultural norms about modesty and gender govern what feels safe. Explain every step before you do it. Keep the person covered as much as possible, and always ask permission before touching. These practices protect the dignity of those we serve. Let me give you 5 concrete practices. Ask before making assumptions. Listen to understand their framework. Examine your own unconscious biases. Adapt your communication style, and involve the trusted people they want in their circle of support. Acknowledging the limits of your knowledge is a sign of respect, not weakness. Every person you care for has lived a full, complex, and irreplaceable life. Their identity is not a variable to be managed, it is the foundation of who they are. When you honor a person's identity, you are affirming their dignity. And dignity is the foundation of everything we do in this course. Recap: be curious, stay humble, and always be willing to learn from the person in front of you. Download your Lesson 4 workbook from the resources section. It includes the Learn Framework card and a personal reflection exercise to help you apply these principles today. Thank you for being here and for the vital work you do every day as a caregiver. I look forward to seeing you in Lesson 5.